Fat grafting to the breast involves removing fat cells from somewhere else on the body via liposuction. So liposuction is done by infusing a fluid into the flanks, the abdomen, the thighs, wherever we're going to obtain our fat grafts, and then sucking out that fluid along with fat cells. We then capture those fat cells in sterile canisters on the operative field. The fat cells are then purified and re-injected into the breasts where we need to add volume and improve contour. That is what fat grafting to the breast is. So some people might say, well, you do these deep flaps, how come you can't just squirt a bunch of fat in the breast and have it live instead of having to do microsurgery and hook up blood vessels? Well, it all comes down to volume and surface area. So with fat grafting, what we're doing is we're sort of spray painting little individual fat cells within the sponge of tissue that already exists. In other words, the tissue around those fat cells is what keeps them alive. And the fat cells can be no bigger than 2 millimeters in diameter or they won't stay alive. So they have to be very small and they have to be very spread out and infused within a sponge of living tissue that is already on your chest. So that is how fat grafting works. How much fat lives depends on the person and the recipient bed. So if I'm injecting fat into someone's deep flaps or someone's native breast tissue as a cosmetic case, there's a high percentage of fat that's going to live, between 50 and 70%, because the vascularized bed or the recipient bed is so good and so large. If you have very thin mastectomy skin left behind, there's just not as many places to inject the fat. In other words, the sponge of recipient tissues to put the fat is very small, and therefore we can't expect much fat to live because we don't have much room to inject the fat. In other words, the recipient bed is very small, and therefore we can't inject a whole lot of fat grafts. But that is a summary of fat grafting to the breast. For information about the recovery, check out my recovery video. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.